Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you. Okay, welcome back to the last segment of the show, and one of the things that we got Roxanne's question basically, and her question was she had been taking two opioids, oxycodone and hydrocodone, and developed gastritis and acid reflux, and then after she stopped that, she basically had her acid reflux go away. And so does oxycodone or hydrocodone cause acid reflux? Well, I don't know that it actually causes acid reflux in per se, but let's talk a little bit about what might be the cause of that. Normally when you take medications, you have to drink them with something or eat them with something, and so now you're having to swallow a lot of medication. Sometimes if you're in pain or you're having to take that medication, you're lying recumbent, you're not really up and doing a lot of activity. So therefore, in doing so, you basically allow for maybe the potential for more reflux in that sense. Not only those medications do slow gastric emptying a little bit, and as you know, people suffer from constipation when they're taking opioids, so that might have some problem with that, not letting things to go through your stomach as quickly as possible. So that might be that. And of course, there is some issue with the possibility of some pain medications actually causing irritation. Tylenol is not one of those, and oxycodone is not a direct irritant to the stomach that I'm aware of. You might have been taking a non-steroidal when you were in pain and taking those medications, and that would be a direct irritant to it. So I have a lot of people, I think reflux is a really big problem today in general. And I think that a lot of people may have it from a lot of different reasons, but not all of my patients who are taking opioids are suffering from reflux-related problems. So can't really blame it on that. I might have you look deeper into the situation that you were suffering with to see what else might have changed in that area. So I hope that answers your question, and I'm glad you're not suffering from reflux anymore. And remember that the over-the-counter products like Zantac, Pepcid are very good agents. Prilosec is very good over-the-counter, and you don't necessarily need to see a physician for that. However, late effects of reflux, or difficulty swallowing, esophageal stricture, those things are delayed effects, not to mention esophageal cancer, Barrett's esophagitis, and a lot of other things. So when you're masking symptoms and you're having to take that, it's probably not a bad idea to think about visiting a GI doctor so that he can do that. Now, I notice I have one of these things that this is one of the drinks that I like to have. It's the San Pellegrino. If I'm going to have sugar in my diet, I like this because it's natural sugar, and it's only about 140 calories. It does have some fizz in there, but it's non-GMO related, and it is basically not a product that where I get high fructose corn syrup. So I tend to stick with the more natural agents so that we can I can better work off those particular calories. And that was a subject that someone said about drinking Cokes today, and I definitely think diet drinks cause weight gain by tricking your mind into having more. People running around with a 48 ounce of diet things thinking they're doing well, or probably not. I would just go ahead and have the sugar. 140 calories isn't the end all, the be all. It's not going to make this huge difference, even though 100 calories does add up over years and years and years. Remember, it's not so much the calories you eat, it's what you do after you eat that again makes the huge difference. So, this lady who is gaining this weight is basically forcing herself to make fat. And remember, I've talked about it on numerous shows before that people who, the bodybuilders who, and I think we had, I asked Gary, who was on the show. He does Alien Rage and a lot of bodybuilder. Basically, they're injecting themselves with huge amounts of insulin, which is very dangerous, but they're injecting themselves with insulin before they work out. And that is, they're bulking up with their muscle extremely, it just builds muscle. And they can't pick it up. It's not like they can take for steroids, and using anabolic hormones will cause a condition called peanuts. Basically shrinks the male testicles down to nothing because of the high doses of steroids. And then they don't have any testosterone, and it's really horrible for them later in life. So very important for people to realize that you can take a page out of their book by basically going and exercising after you eat. You don't have to work out, you don't have to, pump weights or do that kind of stuff, but every sugar molecule burned is a sugar molecule that is not basically be deposited in your fat stores. So I suggest you not eat unless you can get up and walk and do something to burn those calories off. Let's see. So nobody else is. I think we have a few more minutes, and I don't know if Ray is planning on calling in. I know he might, but sometimes he's not. So he goes to drug court a lot, and he hits in there and he sees some of the people that are in there, and I think it's kind of a sad statement in our community when we have so many people who are using and addicted to controlled substances, and so much is a waste of our community effort in trying to do those. I would encourage people that if you think you might have an opioid problem, that you do consult the 12-step programs, NA and AA. They are very, very helpful. But you have to be willing, you have to basically have a desire to get off of what you're doing, and you have to be open to the concepts of a 12-step program. It's the only thing that really works, except a huge hammer over people's head. But they do drug test these people, they give them a chance. I've even heard that they'll give them a couple of chances, but if they're turning in positive urines, they're going to send them away. And it's just like, whatever problems you may have today, I don't care what they are, divorce, losing a job, whatever your reason for wanting to use a controlled drug, it's going to be there when the drugs are gone. Nothing is made better by the use of opioids. Yes, it numbs the pain and it basically takes you away, but it doesn't solve the issue. And real problems need real solutions. And nobody ever gets anything done by hoping that it's going to get done. It has to be getting done by your action. So let's see, we have another call since we're having trouble. Ray is stating that doctors who subscribe to Suboxone can only have 100 patients. That may be true. I don't know. If that is true, then I don't know, and that's a good question. I don't prescribe that. I think you have to take a special. You have to be licensed by the drug enforcement agent because it's a combination of a couple of products, and it's very useful in avoiding addiction. But let me tell you, 12-step programs are as good as any medication out there. And you just have to want to quit, you have to desire to quit, and you have to be willing to go to the meetings, and you have to be willing to listen to what they have to say. The only reason people fail in 12-step programs is because they just don't take it seriously enough. But I'm going to tell you, an addiction is every bit as deadly as HIV. And it's every bit as deadly as hepatitis C. Well, not anymore because they have a cure for it, but it's every bit as deadly as any of the deadly diseases out there. There's only three things that can happen to an addicted person. You will go to jail, incarceration, you will die, or you will go insane. There is no other option other for addicted people. And even if you take Suboxone or another product to help you get off the problems, you still have to learn coping skills. And the coping skills are what is taught in the 12-step programs. How to make amends, how to forgive people, how to not take everything so personally, not learn how to deal the things that maybe people normally deal with, but maybe for some reason the addictive person doesn't have an idea on how to do. They want to blame everybody else for their problems. The world is out to get them. Poor me, poor me, poor me. And that's not the way it is in the real world. Real people solve real problems. They get up, they go to work, they be productive, and they try to make a difference in the daily life. People that don't do that are stuck in a rut, and they feel sorry for themselves. But nobody feels sorry for you, and you can have any excuse you want to get on drugs and feel bad. But if you decide you want to take a positive step, contact some people in recovery. Get in the phone book. They're everywhere. There are meetings all over the place, and it does work if you work it. You have to go to the meetings, and it's just a very, it's free. It costs $1 if you want to donate $1, and you get in touch with people who have beat that addiction every day. So I encourage people to do that, and with that, I will be signing off, and see you next week. Have a great night.